All right, we're going to go ahead and get started with our last but not least presentation of the day. This is Brendan Sayers, PA Brendan Sayers, also my coworker. He earned his Bachelor of Science degree in microbiology from the National University of Ireland in Galway. He began his career as a senior research associate at Memorial Sloan Kettering Cancer Center in New York. Knowing that he wanted to find a career that would involve more patient interaction and work in the operating room, he went on to earn a Master of Science in Health Sciences for physician assistants from Cornell Medical College in 2011. Following graduation, he worked in thoracic surgery at Memorial Sloan Kettering before moving to Texas a few years later. Brendan currently works at the UT Southwestern Medical Center as a lead robotic surgery APP. He and his team of 3 APPs first assist in robotic surgeries within various surgical subspecialties. So here's his presentation on the Irish PA system. Thank you.
Thank you. Thanks very much for inviting me today. It's a fine Irish day outside. When I woke up this morning, it was very appropriate. So today I'm going to talk a little bit about the role of the PAs in Ireland. Now, I know it's a hot topic, but the PAs in Ireland and the UK call themselves physician associates. So I'm not going to get into any of that. I'm here just to talk about the PAs, the physician associates in Ireland. So as Patty said, I am from Ireland. I grew up down in the southwest corner. Let me see if I can pull it up here. So right down here. I went to college in Galway and I never left Ireland until I actually landed at JFK in New York and then started working in Manhattan doing research. So how I got from Ireland to Texas is a long story, probably would require a lot more time and beers to talk about that one. But so the picture on your right is basically a mountain that was behind our house. And this is where this little mountain here is where I grew up. So which I often think about when I'm about to start a 6 or 7 hour Whipple. Why are we doing this? But here we are. So today what I wanted to talk a little bit about pretty briefly was just getting into understanding what the Irish healthcare system involves and how the Irish system introduced the PAs. And so we'll go a little bit into about understanding the education and training that they are now requiring, their scope of practice, and understanding some of the benefits that the benefits of having PAs in the Irish healthcare system. And then also we'll go into a little bit about some of the challenges that these PAs are facing. So the Irish healthcare system is a publicly funded system, and it is open to all members of the public who live in Ireland or who are residents in Ireland. The one thing with the Irish healthcare system, it is run by the Department of Health, and it is the Department of Health basically is responsible for developing the healthcare policy, and the healthcare executive is responsible for delivering the healthcare services. The system in Ireland is actually a 2-tier system. It has a public system and also the private aspect to the system. In Ireland, about 36% of individuals have they require, because of their income, do not have to pay for any of the services, and so they will get all their services through their medical card. This will also include prescription drugs and any type of surgery that they may require throughout the while they're in the system. Over the years, the development of the private or the private health insurance market has really grown over the past several years. And so now about 45% of the population will take up the private health insurance so that they can supplement covering the cost of the hospital stays or medications and whatnot. So as a patient, where if you require any treatment in Ireland, basically your first protocol is going to your general practitioner, your primary care physician. And so they will basically, once you see them, they're essentially the gatekeepers, and they will send you in what direction that you may require to go. In the system, if you do require any type of emergency services, they are, of course, taken care of through a network of public hospitals. There is about 50 public hospitals that are completely free for the residents through any of the emergency services. So, there are several issues actually with the Irish healthcare system, as they are with many of the healthcare systems across the world. However, it's really the mix of this public and private, this overlap that we have. Essentially, a lot of the challenges that they face are, essentially based on the capacity. There's not enough capacity within the hospitals. A lot of the patients within the system are waiting months on end just to be seen. So, for example, last year, over the course of last year, about 120,000 patients experienced overcrowding, and they were, as of January of 2020, there were about 13,000 patients waiting for beds. So across the entire country, 30,000 patients waiting just to be to get access into the system to be taken care of. Some of the other issues that they have are long waiting times, and these waiting times can last for, just to say, for a surgical procedure, you're waiting for at least about 15 months as an outpatient. For 15 months to to have a procedure to be as an inpatient, and about the average is about 10 months to be seen for like a day surgery. So the waiting lists are enormous.